Hello, everybody. Happy Tuesday. We are going live today with Chumi from the Ice Life, and we're going to be discussing her mental health journey and healing and wellness. And she's being very generous about sharing her process with us, and we got a lot of good questions. So I'm really excited to tackle that. Hello, Chumi. Thanks for joining. Let me add you 1 second. Invited you. Let's see if that works. Hi, Chumi. You hear me? You see me? We're good?
We're good.
Amazing. I'm so happy we were able to make this work. I know it was like a few weeks in the making. I canceled and you had to cancel and we made it. Yay. Yay, yes.
Life happens. I know,
Yeah,
it's so
exactly.
crazy. It's really just because
Exactly.
Tuesday's my only day that I
Yeah,
have like all day. So
totally. No, I totally get that. Okay, amazing. So we're at it and we have till 11:15. And I see so many of your followers are joining. This is so exciting. Okay. So do you want to start like giving, I guess, like a little bit of backstory just for people that don't know about your story, what you're comfortable sharing? And I know you're like an open book, which is such a breath of fresh air. But some people, I guess, when I opened it up to questions, said like, can she share about her mental health diagnosis, struggle when she was diagnosed? I didn't even know any of this. So like you share whatever you're able to share.
okay, so in short, I had my first kid just over a year after I got married,
Mm-hmm.
and he was actually born in Scotland where my parents are, and then I
Mm-hmm.
flew back with him to America when he was 4 weeks old.
Mm-hmm.
And there was no like WhatsApp or Instagram or like even internet. Like
You're
we
making
moved.
yourself sound
I
so
know, but
Asian.
it's
You're
really
so
not
young.
that old. It was 11 years ago, but there was
Wow.
no like we moved. We got Wi-Fi, and we had
Yeah.
I had like Skype.
Oh,
There wasn't really like this FaceTime like nowadays. So
right.
I was really very, very far from my parents. None of my siblings lived here. I had
Mm-hmm.
my in-laws, but it wasn't, it's my in-laws. And
Yeah.
I felt like something was off after he was like after that, but I was too busy, and I was like, okay, it's birth control, it's this, it's that, whatever. Then I had my second when like just before my oldest turned 3, I had number two. So they're
Okay.
like just under 3 years apart. And after he was born, like he was 8 weeks old, and I went to work. I got a job, and it was full time. So we
Mm-hmm.
were all out the house from about 8:30 till 6 every single day, and it
Wow.
was really intense and really hard. And I found myself just not like I was really depressed. I couldn't deal with anything. I would like drive to work and just like hate driving to work. And then it came to like, and I knew something was up, and I didn't know how, like I didn't want to admit it. Like I was kind of
Mm-hmm.
waiting for my husband to kind of notice something, but he had no idea about postpartum depression, so it wasn't something that he knew that I was down, and he knew that I was overworked and overtired, but he didn't, even myself, like we didn't really know what was going on.
Mm-hmm.
And then one day I was like, okay, it's crazy that my son at that point was already like 16 months old. And I was like, okay, it's crazy that I'm like driving to work, and I just want to like drive into a wall. Not,
Oh my God.
I didn't want to die. I did
Mm-hmm.
not, but I did want like a break. Like I wanted to be in a
Run away.
hospital. Yeah. Like I
Yeah.
just wanted to be out of it.
Yeah.
And so I stopped. I told my husband, I called him, and I spoke to him, and I was like, I'm terrified. Like, I need you to come with me. And we went to the doctor, who gave me a therapy referral. And it started there. So my son was like 16 months old. So
Your second was 16 months.
yeah, yes. My oldest
Wow.
was 3, and my oldest was 4. My second was 16 months. At that point, so that's probably like 7 years ago. Yeah,
Wow.
6.5, 7 years ago. It took like a good year of therapy. Like I went to one therapist for a few months, and I just hated it. Like I didn't
Mm-hmm.
feel anything when I left. And then so I left her, and then it took another couple months to get to someone else, and I had an appointment for a psychiatrist, and I canceled it because it was my brother's wedding, and I didn't want to go.
Mm-hmm.
And like it just kept going. It took about another year before I finally was like, that's it. I found a psychiatrist. I just went. My husband took me because I was way too afraid to go myself.
Yeah.
And
Yeah.
she was like, you have postpartum depression, like right away. She asked me like 5 questions. I'd filled out a form, and like within this, she was like, oh, you have postpartum depression and anxiety. And anxiety is something like, looking back, I'm like, oh, I was such an anxious kid. Like I've had it for
Right.
years, but not so bad. Like postpartum really brought it out.
Mm-hmm.
And then so I started going to therapy then, and that was for like 5.5, it was probably about 5.5 years I was on medication, going to therapy. And then I got pregnant, and then I wanted to get pregnant. So I weaned off my medication, which itself took like a year.
Mm.
And it was awful. But I I got pregnant, and then my anxiety came back full force because I was really, really sick.
Mm.
So
And also like all the hormonal changes, and you're off the medication.
yeah, I'd been off
Yeah.
the medication at that point for like 2 months, maybe not
Hmm.
even, and I was extremely, extremely sick. And I have one of my anxiety, huge anxiety sort of like things is I have a emetophobia, which is like a severe fear of vomiting and
Mm.
anything to do with that. So it was really, really a killer that I was lying in bed throwing up from pregnancy
Oh
when
my
I had this like fear of throwing up. So every time I had to throw up, I was having a panic attack, and I would just lie in bed like trying not to throw up. And then when I like had no choice and I had to, I I would like freak out. It was horrible. So
That sounds like
at that point
torture.
I was so well versed in like myself. I'm like, okay, I need to get back on the medication. So I found a different psychiatrist who was reproductive psychiatrist, which is like
Hmm.
they specialize in people who are in the reproductive age and stage.
Hmm.
And she right away put me back on the medication. I was still in therapy like every 2 weeks, um, and then I had my baby, and I was like, I needed a break from therapy because I just like it was being 5.5, almost 6 years at that point, and I needed like
Hmm.
I was burnt out a little bit from my therapist. I needed sort of like a break.
Yeah.
So, and I had my baby and everything, so I took a break from her, and now I have the reproductive psychiatrist that I see. They do what they call like a psychotherapy appointment. So
Hmm.
once a month, I have like a 45-minute appointment instead of like
Mm.
psychiatrists usually give you just like a 15-minute quick appointment and then you
Right.
speak to your therapist. But like once a month, I do like a 45-minute appointment, and I can also take I also have their messaging system. Like I can message them if I need an extra session or whatever.
Hmm.
And it's nice because it's like it's just a change. It's not the same therapist, and I'm at a different stage now. I'm not.
Right.
My therapist was great. I loved her. She was amazing.
Hmm.
I moved on from there, and so now I'm seeing someone else, and I'm still on my medication. Especially, they don't want me to go off just yet. My baby is turning 1, so
Okay.
honestly, like sometimes I'm like, oh, I could probably go off this, and then other days I'm like, oh no, no,
It's a
like
good
I
thing I'm
need a
on.
higher dose, like I need more, like so. Yeah,
I
that's
love
pretty
the I
much
love the
my.
honesty. I love how refreshing this is, and I'm sure people that are watching and listening are also enjoying this. So that's so interesting. I never even knew this about you. Like I knew like we know each other a bit, but like not to this extent. So like I so appreciate the whole backstory, and it's so interesting. So like up until you had your first kid, you never like struggled really with mental health, like other than like like now looking back, you can say like, oh, I had anxiety. I'm saying who
So
doesn't have
I
anxiety?
definitely had anxiety. I mean, I had a emetophobia, and it affected a lot of areas of my life, but it's progressively gotten worse.
Mm-hmm.
Um, so I definitely looking back, I'm like, oh my gosh, like the medication would have made my life so much easier then. But no, it wasn't taking over my life. It was
Mm-hmm.
there, but it
Mm-hmm.
wasn't taking over my life versus when my second kid was born and then it started taking over my life. And
Got it.
that's how I knew it was that, I needed to take care of it
Mm-hmm.
because no one was going to do it for me, unfortunately.
Right,
So,
exactly. That's how life works, right? Like we need to
yeah.
take care of ourselves. No one does it for us. So like on a day-to-day basis, would you say like now you're I guess like this goes into like the second point. And somebody actually asked this, like, what does healing mean for you? And like what does your journey now look like? So you're on this medication, you're seeing the psychiatrist, let's say for a longer appointment once a month, and you're talking about whatever is going on. Like you're super high functioning. So like I'm curious, and I'm sure people are as well, like what is your, let's say, day-to-day struggle? And like where does your like mental health techniques and coping skills like come into that kind of thing?
So it's very hard to pinpoint one thing
Mhm.
because I just see that my two sisters joined.
Okay, is that
So
okay, or
busy.
should we kick
No,
them
I
off?
don't know. I don't mind. I thought they were busy, but I see that they both joined and they're standing together. So okay,
Okay,
hi.
we can
I
kick them off. We can get like Zuck
yeah,
involved.
I really don't care. My sisters
Okay,
know
okay.
everything. Um, so it's very hard to pinpoint one thing because I'm not that kind of person that can be like, oh, I healed in this specific way. Like this is
Sure.
how I'm very not spiritual and like touched into myself at all. Like I
Hmm.
medication, give it to me. Like give it, I'll drug myself. Like
Yeah.
that's my type. Like I'm not like the person who does the self work.
Okay.
But looking back at my therapy, I can see how much I've changed in like those 5 years. Like in the moment, it didn't feel like it was doing anything, but looking back, I can see I'm much more accepting of myself. Like I now accept. So like I'm on medication. I still have hard days. I do. Everyone does, even when you're on medication, because medication doesn't heal you. It just kind of
and
helps you
hopefully it doesn't
through
numb
it.
you, and hopefully it
Yeah.
doesn't numb
No,
you
it
to
doesn't. It helps. I feel like it's like I always call it the crutch. It's literally like being on crutches. It's an extra support while you do the work. So my dose is
exactly.
way, 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 way lower than it was when I started. I mean, like I'm on such a minimal dose that that's why my psychiatrist is like, you could stay on this for like forever technically, because it's such a low dose, not doing loads, because I've done the work on myself. So I mean, I guess you could say the work I've done is I'm much more accepting, I'm much more understanding of myself. If I feel like I'm exhausted and I want to take a nap instead of doing the dishes, I'm like, okay, you deserve to take a nap. That's fine. I don't kick myself as much. Definitely not.
Like your inner critic,
my inner critic is like,
got a
is
little
not
quieter.
telling me, oh, you should have done this, you should have done that, you should have done the other. I'm much more like, it's fine. It's fine. Like I do I really go all out for myself. Like I never used to. I used to be so like, I never used to buy myself things. I very rarely used to, like, doing my nails was like a huge thing. Now I do my nails every 3 to 4 weeks. That's it. This is my thing. I don't care. Like if I need it, I do it. And
I noticed that actually, like on the line. I was like, they're so cool.
my husband's also been instrumental in that. Like,
yeah, I want to hear about that, because I feel like people that are listening, I want to hear like how he was instrumental and how you almost got him to be instrumental, because I think that initially you said my husband didn't know what was going on. So clearly there's something that you communicated and how you communicated that allows him to be there for you. And I think that's really important for people to hear, like how to communicate to your spouse what you need at this time.
Right. Well, so that's one thing that I have as like my personality, is that I'm not like, if someone tells me a secret to keep, like I'll keep the secret. But for myself, I'm very open, like especially to and my husband is my husband. He's that there's nothing that we don't know about each other. Like we talk, and a lot of it has to do with the fact that we got married and I moved 3,500 miles away from my parents when I was married for 6 weeks. Wow. So my husband was the only person I had. I mean, like, yes, I had a cousin here and I had my in-laws, but that was it. I didn't have any friends. I didn't have any, like, I wasn't going out at night to hang out with people. So my husband didn't go out. He stayed home with me, and we would do things together. Everything we did was together. If he would go out, we would go together. If I watched a movie, he would watch it with me. And that really made our relationship what it is. So that really helped. He was always very supportive of me feeling good. He always wanted me to be happy. He always wanted me to feel good. So he always did whatever he could. But again, like how would he know what postpartum depression is? It's not something that he ever came across.
Exactly.
So when I was learning about it, I was telling him about it, and then when I told him, oh, I need help, I can't do this alone, he came with me to the doctor. So the doctor was able to discuss it with both of us, and then he listened. He was, I guess it's very, like, I feel bad, like I don't like bragging. Like I know a lot of people don't have this. It's not something I take for granted. But he's my husband. He's good. He's great for me. And I know other people will be like, oh my God, no, I can't do that. For me, this is what works. This is how my husband was good for me. He listened. He pushed me. He kept holding on, like holding me and pushing me and helping me to go through. And so that, it really helped, because he listened to what it was about. And I would send him links and videos about postpartum depression, and he would watch it and he would listen to it. So he knew. So he was learning with me. And then
so what you're saying is that, like, he was educating himself, and part of that was also you helping him educate himself.
Yeah,
like you were saying, like, come with me to the doctor, like, or that was just taken for granted, or sending him these videos or links or whatever it was. I think that's like a really good point. I know you take it all for granted. Like, that's what I'm here for, to like pull out what you're saying and be like, this is a good point. Like, take your pen and paper, because I think that, we just assume that, like, because we're in it, we're going to be Googling all night and understand everything. And then we imagine that, like, through osmosis, it goes to the other person or people in our life that we want them to be aware of whatever's going on. But it doesn't happen like that. Like, we need to sometimes, like, send it to them and be like, it's really important for you to understand this and to read this and to, to be educated so you understand what I'm dealing with.
Right. And I would also, I would finish therapy and I would call him and unwind on him. Which a lot of people are like, oh, I read this and I've heard it, like, marriage tips. Don't unwind on your husband. Have another friend to do that with. I don't have another best friend that I unwind to. So I unwind to my sisters. And if there's something that I don't want to tell my sisters, or like it's just not something that's just gonna like my therapy session, I'm not gonna tell my sisters my entire therapy session, especially if I've been complaining about them. But like
I hope they left already.
no, I like, you know, I tell my husband, and people are like, oh my God, like, how can you, because that's just the relationship we have. And a lot of it stems from the fact of our situation that I moved to America because he wanted to live here, and he knew that part of that would be to stick with me and to help me because I didn't have anyone here. So he was very, it stems from the way our relationship is, and not everyone has that relationship. I think I always tell my followers, like, the most important and the best thing you could do is that, like, every time you see an article that you feel connected to, like, oh, this is me. Even a meme on Instagram. I mean, I send my husband all these anxiety memes and like videos and funny things and silly things. I forward it to him because if it like connects with me, if I feel like that's me, I forward it to him so he can understand where I'm coming from. Even if he sees a meme and he's like, why is that funny? And I'm like, it's not necessarily funny for you. It's just funny for me because this is how I feel. And then he's like, oh.
Right, exactly.
And so it doesn't really matter what your relationship is like. I'll say that I'm definitely generalizing over here, that for people who have a supportive spouse, that makes a difference. And I understand, and unfortunately not everyone has that, or supportive parents. I do think that whenever you see anything that you connect with, an article, a piece, if your therapist tells you something that really like there's a feeling,
resonates,
like, resonates, like it's a feeling like, oh, that's me, like that, then tell the person you want support from, send it to the person you want support from.
I couldn't agree more. Like, it's reminding me, like, I recently, or I don't know how recently, but like sometimes I look up like zodiac signs. I don't know if you believe in those things, but like I find sometimes they're so on point, and I feel
like I don't really believe in it, but sometimes
like, you don't have to like believe in it. It's just a matter of like, I feel like this is so on point sometimes, and I'm like, wow, like I don't need to say another word to anybody to help them understand me. Like, I could just send them this link and like they'll understand like all my strengths, all my weaknesses. Obviously there's more intricacies and uniqueness to everything, but sometimes it's like so on point. And if you send that to like a significant other, or to a friend, or to a therapist, or to whoever you want to be supportive in your life, you're giving them like a manual, a map to understanding you. You're giving them one more, you're helping them take another step closer to understanding what it's like to be to live in your skin.
And I think we're very lucky, like we have now, like Instagram, like people criticize it. At the same time, I strongly believe that Instagram really did help me. It really helped me a lot. Being able to be open, to have a public page, but also seeing all the therapy things and the memes and the comedy and like other people who are going through exactly the same thing that I'm going through. And I'm like, it's a connection that, and it makes it much easier to share with other people.
100%. Yeah, I'm also like, I think that, you know, everything is a tool in life, and it can be used for a force of good or a force of evil. And I think that there's many ways that it's used for a force of good, and we underestimate that. So I love that you shared that as well. So I think this actually, we bleed right perfectly into our next point, which was somebody asked about dating advice. It just came up. I remembered it as you were talking about your husband, and not everybody's like this, and not everybody's as supportive. So going to, let's say, dating advice, like what would you tell somebody? I know that you didn't have this situation because you were not struggling with this when you were single particularly, but can you put yourself in those shoes, or just like imagine, like, what would you tell a younger sister that's like dating and has a mental illness or mental health struggle, when to share what they're struggling with the person that they're dating, and how to go about that?
Okay, so like I said, it's a little bit of a hard one for me because not only did I not have any mental illness, like a diagnosed mental illness when I was dating, but I didn't really date per se.
Okay,
that's a story for
that's a whole other story. Okay, okay.
My top 2 recommendations, and a lot of people do DM me, and I say this as well. First of all, you don't need to share anything the first date. Like the first date, even the first 2 dates are more like getting to know the other person. So like, how do you communicate together? Can you speak together? Does it fit? Does it click? You don't want to go like spilling your guts, and then after the first date you're like, oh, that wasn't good, right? Next.
Exactly.
And then you
didn't date like you did like you met what how do you call it?
Consider style.
Consider style at the shows. Okay. Yeah. So I feel like I guess like it's not like a perfect question. I'm assuming. I mean, I think I still want to hear your perspective on it.
Okay,
But
so
I think
I
even like the first 4 dates for for people in
right.
let's say
So
my
I'm
circles
saying
are like completely just like connecting and seeing if you like this person enough to spend another date with them.
exactly. So I'm saying it as like, let's say you're gonna date like 4 or 5 times and then get engaged. Then
Okay.
I would say the first 1 or 2, you don't need to say anything because
Mm-hmm.
you're just waiting to understand them. If you're dating for longer and in the circles that you date for 3 weeks, 4 weeks, 10 weeks, whatever,
Mm-hmm.
you can leave even longer. You want to have a little bit of a connection going before you
Mm-hmm.
start spilling your guts. And then the
Totally.
second thing I would say is be honest, be yourself. Because if the person, I always say this, if the person doesn't understand you, he will want to learn to understand you, or he or she will want to, like, if you come to a date and the other person is saying something that you're not 100% sure, like you don't really understand depression, for example,
Mm-hmm.
and you're like, oh, I don't know it, you would, and you feel like you want to connect with the other person and you want to support the other person. I mean, that's the first step of like a great sort of like connection and like a
Connection,
relationship. It's
relationship,
like
yeah.
you want to love the other person, you want to hear more from them, you want to connect with them, you're
Mm-hmm.
going to want to learn more about what they're saying.
Mm-hmm.
So you can either ask, oh, if you're on a date and the other person is telling you, oh, I've been diagnosed with depression and it's really
Mm-hmm.
affected my, you can ask like, oh, is there any articles or books that you could tell me that I could read so that I could learn more about how you feel,
Mm-hmm.
or send me some memes that make that so I can understand more.
Mm-hmm.
If you are the person who has the mental illness, you can say to, oh, like, this is, I have depression and this that affected me. I can send you an article that really helped me understand, that I find really describes me, and I think you'll
Mm-hmm.
really enjoy reading about it. If they're
Mm-hmm.
like, oh no, screw that, I don't want this, then well, they're not the person for you.
Mm-hmm.
And if they are understanding and they're listening and they do read the article and they can
Mm-hmm.
connect with you more, then you've taken that next step. But it doesn't have to be the
Exactly.
first thing you do, and like, it really
Exactly.
doesn't have to be.
I'm totally with you. So a few weeks ago, someone asked this question, and I responded by saying, "Whenever you feel ready." And then on our WhatsApp status, where we have a couple of thousand people following, somebody responded like, "I hear that, and I respect that, but I also feel like that's like selfish in a sense to the other person. Like imagine let's say we're assuming that it's the girl that has a the mental health struggle, and she's dating this guy, and then she tells the guy after a month or two of dating, when maybe it's common for them to date 3 or 4 months, right?" Or further on, and then they were saying like it sounds almost selfish, like to date somebody for so long and then to drop this like bombshell, so to speak, on them. It actually was a good point. Like it was something that I never really considered. I felt like somebody that struggles with a mental health issue, it's their personal belonging, like it's their piece of knowledge, it's their it's theirs to share when they're ready, and that's the risk that we take. And this is my perspective, like unadulterated. Like I haven't thought much about this. I honestly saw this comment this morning, but my perspective right off the bat was just like, that's the risk we take in relationships, right? Like we are trusting the other person to share something when they feel ready. If we take offense to that down the line, then at least be thankful that they shared it then, and you're still a free agent, right? Like there's always an exit strategy. I don't know that the person with the piece of knowledge needs to like share. Obviously there's like certain cutoffs, right? Like you don't want to not share something before a commitment of marriage, especially when you're asked outright about something, whatever it is. Like there's certain things that
I
are,
think
yeah,
I think
go
it
for
also
it.
has to do with, in some cases, and I think this has to do more with people who date less versus people who date more. A lot of times the families will do information. So if the mental illness is something that's public knowledge, then it definitely should be addressed,
Mm-hmm.
the first or second date, because the other person knows about it. They know that there's
Mm-hmm.
something up. If it's
Sure.
not public knowledge, then it doesn't have to be on the first date. For sure not, because it's
Of
not
course not.
the first date, especially the first and even the second, they're really just about connecting with the other person,
Mm-hmm.
seeing, do you like them, can you walk the same sort of pace as them, can you,
Mm-hmm.
is there something there? Like I said, you're not going to spill your entire, you don't need to tell everybody about your, I don't know, oh, every time I eat dairy I have diarrhea. Like you're not going to tell that to a guy the first
Exactly.
time you meet him. But the third or the fourth or the sixth date, you might
Exactly.
say, oh, let's go to such and such a restaurant, and you can be like, oh, I can't eat dairy because it gives me a stomachache. Then when you're ready to share that kind of information, you're ready to share your mental illness. And most people who are dating, I mean, like, I'll be very honest, by the time I met my husband for the third time, we were basically getting engaged already. I was comfortable telling him, I felt comfortable to talk to him in that way. Like obviously there wasn't that much information that he didn't know about me.
Mm-hmm.
And But what I'm saying, like, I was ready to share. I felt connected. I wanted to talk to him more. I wanted him to talk to me more. And it was
Mm-hmm.
vice versa the same way. We felt connected.
Mm-hmm.
And that was how I knew that I was ready to get, for me personally, how I was ready
Mm-hmm.
to get engaged. So for some
Sure.
people, it might take a lot longer. You know, it also
Mm-hmm.
depends on the
On
circumstances.
the culture and like what
But
you're
like
doing.
that like analogy of like when you're gonna share to someone with someone something that's like a little more personal, then
Mhm.
when you feel like you're ready to share that and you think he'll understand what you're saying, then you're ready and you can share.
Mhm.
And again, if he doesn't like it, then he's not the person for you.
Exactly, exactly. So I still like maintain mine, and I think you agree with me. Like it's when you're ready, and like I don't think that you need to rush yourself for, um, for the other person, as long as you're not going into any like specific commitments with, um, in a dishonest way. That's
Right.
like my point.
Like you
Um,
can't have him down on one knee and you're going, oh, by the way, I take
exactly,
Ativan. Like
exactly,
that can't
exactly,
happen.
exactly. But
But
if
you
you're
don't. He
both
doesn't need to open the
exactly.
door for you on the first day, and you're like, oh, my Ativan's in my bag. You know, like there's a balance.
Exactly, 100%, 100%. Where are we with time? We have 2 minutes. We didn't even get to any of your questions that you brought in. Do you want to pick one and we can get to it quickly?
I don't even have them in front of me. Pick one, like
Okay,
whatever
let
you
me see. Meds while pregnant. So we discussed that a bit. So let's just wrap that up, I guess. Someone asked about that, and clearly you took meds while you were expecting, right?
Yeah, okay. So the consensus is that there is not very little, if any, research about any kind of SSRI or such kind of oh my gosh mental illness medication. I'll say because I don't
Mm-hmm.
remember the right name. Um,
Antidepressants or
Antidepressant,
SSRI.
right? Like that kind of medication. There's no real research on how it affects the baby.
Mm.
So, what there is research on is how anxiety and depression in a pregnant woman does affect the
Affects
baby.
the baby.
So
Okay.
there's a lot more serious effects from anxiety and depression on
Mm-hmm.
an unborn child and newborn than there is from taking the medication.
Okay.
So for me, let's say I was taking Lexapro, and the only thing that they worry about with Lexapro is that the baby can have a small heart issue that is really nothing in the long term. It's not like a major issue. There's no surgery needed. It's just like what they did was they gave me, I think, 2 extra sonograms just to check the baby's heart rate. And when the
Mm.
baby was born, they did like an extra, like they checked her heart, like a couple more times, just to make sure
Mm-hmm.
everything was fine. Um, and it was.
Mm-hmm.
However, anxiety has not just effects on like early preemie births, small birth weights, anxious babies, but it can last a lifetime. Like being
Mm-hmm.
anxiously pregnant and it's not taken care of can really have long-term effects in the child, and they've seen these effects. Like
Mm-hmm.
these are effects that they know about.
Yeah.
So basically, the pros outweigh the cons if there are any, because we don't know if there are,
Right.
by a lot. So there are some medications that are obviously safer than others, and but
Mm-hmm.
Lexapro is considered a really safe um,
Medication.
medication. And like I mean, I had nothing, like Baruch Hashem, nothing affected my baby or me, and
Wow.
and my pregnancy would have been so different if I wouldn't have been on them.
Right, and I'm sure the baby as well, and everything,
Yeah.
and the recovery from birth and all that. So I love that you shared that. That's like brilliant, and I think that's so helpful for people to hear. Like I
I
honestly
do just
haven't
I
heard that.
want to just say one thing. Like my first psychiatrist I had, she was my psychiatrist for 5.5 years. She was great, and she listened and she did everything I needed her
Mm-hmm.
to do. But she was old school, and there are a lot of
Mm-hmm.
old school psychiatrists out there that don't know the newer research
Research.
on these things. And that's why when I realized that I'd gone off and I realized I was pregnant and I needed to go back on, I looked up reproductive psychiatrists. So for anyone who's listening that's in, I guess, childbearing age or stage,
Mm-hmm.
anywhere from like 18 to 40 or even
Mm-hmm.
50 for some people, you can reach out to a reproductive psychiatrist. They're pretty new, so they're not going
Mm-hmm.
to be so many, but you can go online and
Mm-hmm.
you can find them, and they are much more in tune with what is good or not good, and how they can work with you while you're
Sure.
pregnant or while you're nursing and things like that.
Sure. I love that you brought up that point. That is so important. And we've had people reach out to us on OK Clarity, for a specific like reproductive psychiatrist. I don't know that we have any like specifically on the platform at this time, but we definitely did some like research for them. And they do exist. And some psychiatrists that you hear of have an additional specialty in reproductive psychiatry. Some of them just specialize in that, and that's all they do. So
Right.
it's really
So
important.
the psychiatrist I'm seeing now, she that basically because my insurance doesn't really cover her practice, she
Mm-hmm.
has students where the copay is like much, 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 much lower because they're
Mm.
students. Now, I've had two. I'm currently on the second one, and both of them they were both midwives. One was a nurse, then a midwife, and is now doing an additional degree to become
Wow.
a psychotherapist. And the
Mm-hmm.
other one was just a midwife. And so they're really in tune with me when I was pregnant. They didn't just help me with my mental health, but they helped me. Like, they were like, oh, you're feeling that pain? Well, try this, try that. They were very
Wow.
aware of like the whole extended situation. And the practice is actually also run by a midwife. Her name is Rebecca Feldman. She works in the Bar Park OBGYN midwife office.
Mm-hmm.
And she's a midwife, and she's also a psychiatrist. So
Wow.
they're really,
Wow.
really in tune. And like, that's a reproductive psychiatrist. A lot of them are in that. Like, they have like 2 or 3 sort of degrees, I guess.
Degrees, right, that like
Um,
led them up to this point. And
yeah,
they really have like they kind of treat you from a holistic perspective, and they're not just like, they didn't just read one research paper and like know how to prescribe. They
right.
get the whole picture.
Yeah,
I
so
love
they're
that.
definitely out there. Like, you can find
Yeah.
someone who's good, who's gonna help you in your specific situation.
Love that. Love that. Thank you so much, Chumi. This was amazing. I really want to do like a part 2. There were so many other good questions that you got. And I'd love to address them. So maybe we'll schedule offline part 2, and we'll announce that at some point.
That sounds great.
Amazing. Thanks so much for
Are
being
you
so
saving
open.
this on your page?
Yeah, I'm going to save it. I'm going to
Okay,
tag you
good.
before I post it so that I think you'll be able to then post it on your feed as well.
Oh, okay, cool.
Okay, so let's
All
do that.
right,
Thanks
great.
again.
Thank
Thank you
you.
everyone for tuning in. Take care.
Bye.
Bye-bye.